Digestive physiology, important question. Give organization or layers of GI wall from outside to inside or inside to outside, mucosa, submucosa, circularis, smooth muscles and longitudinal smooth muscles, serosal layer. Mucosal layer mainly contains glands, muscularis mucosa, connective tissue, and lymphocytes, whereas submucosal layer contains connective tissue, blood vessels, and lymphatics. Circular smooth muscles will be thicker near the sphincter at the sphincter. Longitudinal smooth muscle layer and serosal layer. What is enteric nervous system or little brain? Give the neural innervation of GIT. There are two main innervation: intrinsic innervation and extrinsic innervation. Intrinsic innervation consists of myenteric and mesenteric plexus. Myenteric plexus is also called as Orb's plexus. It is motor in function. It increases the tone, intensity, rate and velocity of rhythmic contraction. It is concerned with the control of peristalsis activity of the GIT. Whereas submucosal plexus or mesenteric plexus mainly is sensory, and it is concerned with the control of exocrine and endocrine secretion of by the cells in the GIT. They also contain the local blood flow. Extrinsic innervation includes sympathetic and parasympathetic innervation. Parasympathetic increases the GI motility and the tone, whereas sympathetic decreases the GI motility and the tone. Parasympathetic relaxes the sphincter, whereas the sympathetic contracts the sphincter. Parasympathetic increases the secretion from the stomach and the intestine, whereas sympathetic decreases the secretion from the stomach and the intestine. Related question what they can ask is what are the functions of myenteric and mesenteric plexus of GIT? What are crypts of Lieberkühn? These are intestinal glands. They are intestinal glands which shows the active mitosis and replace the cells, dead cells every 3 days, lining the small intestine, and the secretion which leads to the secretion of the protein by the cell, sloughing up to 30 grams per day. They contain goblet cells, then enterochromaffin cells and Paneth cells. Paneth cells secretes a defensin, which is a natural antibiotic. Enterochromaffin cells secrete secretin and serotonin 5-HT, a powerful stimulant of intestinal motility. Goblet cell secretes mucus. Give the functions of Werner's gland. Werner's glands are the special submucosal glands present in the duodenum. They have large volume of thick alkaline mucus secretion, that protects the duodenum mucosa from the acid secretion from the stomach, gastric acid. Name the salivary glands and which gland contribute maximum to the salivary secretion. There are three types of major glands are three, like parotid gland, submandibular gland, or submaxillary gland, or sublingual gland. The parotid gland, even though it is large, it contributes only for 25%. Its cells are purely serous in nature, whereas submandibular with both serous and mucus, sublingual also both serous and mucus, whereas submandibular its serous secretion is more, in sublingual mucus secretion is more, and total contribution for the saliva secretion, parotid gland only 25%, whereas submandibular gland 70%, sublingual 5%. What are the functions of saliva? Taline present in the salivary gland, salivary alpha amylase, helps in the digestion of starch to alpha limiting dextran and maltose, or at the optimal pH of 6.8. It readily inactivated by the pH less than 4. In acidic pH it is inactivated. Mucin lubricates the food, facilitates swallowing and protects oral mucosa, aids in speech, and serves as a solvent. It activates taste buds, prevents dental caries as it contains lysosomes and hemoglobin A and lactoferrin, which is a bacteriostatic, and buffers and prolines rich protein in saliva, maintains the pH of oral 7, which protects the tooth enamel and helps to neutralize the gastric acid reflux. What will happen if the pH of the saliva is decreased? Normal pH of saliva is 7. Acidic oral pH leads to loss of calcium from the teeth. What is the difference between the primary and the final salivary secretion? As in our cells, primary secretion, which is isotonic, and the salivary ducts being relatively impermeable to the water. Finally, the salivary secretion is hypotonic solution, rich in potassium and bicarbonate. What is the role of ANS in control of salivary secretion? Stimulation of parasympathetic nerves perfuse watery saliva with relatively low content of organic material and protein. Stimulation of sympathetic secretion leads to small amount of saliva rich in organic constituents and mucus. Give various stages of swallowing or deglutition. Stage 1 oral stage, which is voluntary stage. Stage 2 pharyngeal stage. Stage 3 esophageal stage. Stage 2 pharyngeal stage is an involuntary reflex stage. Duration is 1 to 2 seconds, whereas stage 3 esophageal stage is also involuntary reflex stage. Its duration is 1 to 2 seconds for liquid and 10 seconds for a dry food. What is the relationship between the deglutition center and respiratory center? Each act of swallowing is associated with the arrest of respiration, that is called as deglutational apnea. Afferents in ninth cranial nerve, that is glossopharyngeal nerve, inhibits the respiratory center. List disorders of swallowing. Each disorder is separate viva voice question. Deglutition reflex. If abolished deglutition causes regurgitation of food into the nose or aspiration of the food into the larynx. What is aerophagia? In nervous individuals, decreased resting tone of the upper esophageal sphincter leads to the swallowing of the air during the eating or drinking. Achalasia cardia, failure of the lower esophageal sphincter to relax completely on swallowing due to the destruction of the local nerve plexus, which decreases the number of VIP and nitric oxide containing neurons, which leads to sphincter becomes hyper responsive to the circulating gastrin, which causes constriction of the sphincter, which leads to the food accumulation in the esophagus, and proximal esophageal accumulates and then leads to proximal dilation of the esophagus. Dysphagia, it is difficulty in swallowing, causes disorders involving any stage of swallowing. Incompetency of the lower esophageal sphincter. Reflux of gastric acid content into the esophagus causes heartburn and esophagitis, which leads to the ulceration and strictures. This is known as GERD, gastroesophageal reflux disease. Why food should be properly chewed before swallowing? Chewing is especially important for most of the fruits and raw vegetables because these have undigestible cellulose membrane around their nutrient portion, which must be broken before the food can be acted upon the enzymes. What are the functions of gastric glands? Gastric mucous membrane contains three types of gastric gland, mainly gastric gland, main gastric gland, maximum in number, and are located in the body and fundus of the stomach. Contains chief cells or peptic cells which secrete pepsinogen. And in presence of HCl, optimum pH is 2. It is converted into pepsin, which is an active form. Digest protein to polypeptides, proteases or protons. For this, optimal pH is less than 4. Gets inactivated if the pH is more than 5. Curdles the milk, converts casinogen milk protein into soluble casein. Parietal cells or oxantic cells secrete HCl and intrinsic factor. Functions of HCl: activates pepsinogen into pepsin and prosecrete into secretin. It kills ingested bacteria. Converts Fe3 plus iron to Fe2 plus iron, which is an absorbable form. Mucosal cell of the surface epithelium secretes mucus and bicarbonate. These along with the tight junction between the mucosal cells from the mucous bicarbonate barrier prevent the damage of the mucosa. Cardiac tubular glands secretes soluble mucus. Pyloric or antral gland, it contains G cells, secrete gastrin, that is gastrin cells secrete gastrin, also secrete soluble mucosa. Related viva voice question: what is the optimal pH of the pepsinogen? At which optimal pH pepsinogen acts? At what pH pepsinogens get inactivated? Functions of HCl. What are the mucosal bicarbonate barrier? How it is get disturbed? The gastric mucosa. These are also the related viva questions which they can ask. Gastric mucosa resistance to autodigestion. Give difference between the visible and soluble mucus. Visible mucus and soluble mucus. Visible mucus is secreted by the mucous cells of the surface epithelium, whereas soluble mucus is secreted by the pyloric or cardiac tubular glands. Visible mucus, it's a gel-like substances, alkaline in nature, made up of glycoprotein and mucin, whereas soluble mucus is a viscid or sticky secretion. What is the visible mucus? Visible mucus helps in the lubrication of the food and prevents the damage of the mucus by acid pepsin digestion. Whereas soluble mucus lubricates the surface over a very large volume of chyme, which moves back and forth during the digestion. Give the functions of gastrin. Secreted as the progastrin inactive form, which is converted into gastrin active form in presence of HCl or products of digestion. Actions or functions of gastrin: it stimulates the gastric acid mainly and pepsin secretion. It stimulates the growth of mucosa of the stomach, small intestine and large intestine. Stimulates the gastric motility and gastric emptying. Feeble influence on the contraction of gallbladder. What will happen if gastrin is released in a large amounts? Gastrinoma, a gastric producing tumor, can occur in stomach or duodenum, or pancreatic tumor of delta cells. Zollinger-Ellison syndrome. This condition is called Zollinger-Ellison syndrome, which leads to the secretion of large amount of gastrin, which increases the HCl secretion and leads to peptic ulcer. Name. Excuse me. Name factors affecting gastric secretion. Factors which increases the gastric secretion and factors which decreases the gastric secretion. Gastric secretion is increased by the products of protein digestion, distension of pyloric antrum, increased vagal discharge. Gastrin releases peptide GRP, thus an atropine does not inhibit the gastrin secretion. And calcium increases the gastric secretion, and epinephrine also increases the gastric secretion. And the factors which decreases the gastric secretion are acid in the antrum, GI, and other hormones like secretin, gastric inhibitory peptide, GIP, vasoactive intestinal peptide, glucagon, and calcitonin decreases the gastrin secretion. Why atropine does not inhibit the gastrin secretion is a by-pass question. What happens to gastrin secretion in pernicious anemia patient? It is chronically elevated due to the atrophy of the gastric mucosal membrane. List the functions of the stomach. Storage. Normally food stays in the stomach for 2.5 to 3 hours on a mixed diet. Secrete gastric juice, which helps in the digestion of food stuff. HCl, which kills the ingested bacteria. Intrinsic factor, helps in the absorption of vitamin B12 from the small intestine. Causes controlled release of food at a steady rate into the duodenum, proper time for the digestion and absorption by small intestine, and secrete gastrin. List major enzymes in gastric juice and their functions. Daily secretion of gastric juice is 2.5 to 3 liters per day. It is isotonic in nature. Its pH is 1 to 2, acidic due to HCl. HCl converts pepsinogen, which is an inactive form, to pepsin, which is an active form. Renin in infants is converted into curdled milk. Gastric lipase, which is a weak fat splitting enzyme. Lysosome, it is a bactericidal. Carbonic anhydrous is also secreted in small amounts. Name factors affecting HCl secretion. In all factors which increases or decreases the gastric secretion directly affect HCl secretion. First, there will be acid entering the duodenum or stomach, which stimulates acid. If acid is there, this inhibits the parietal cells, or else inhibit the gastric antral. If acid is less, then acid is not entering, then antral cells will be stimulated or parietal cells will be stimulated, and release